Thank you, Andrew. Morning, everybody. And thanks for that nice introduction to health and wellbeing, which is really what I think we're all here to talk about. I'm going to talk about Living Well, which is a new regional framework, and you've also got that title for your local framework as well. And whilst we talk about health and wellbeing, and we've just seen some great images of what health and wellbeing is, for too long we've actually had strategies and targets and investment that's focused more on death and disease. And whenever we talk about health, we know that health is more than the absence of disease, but we've tended to revert back to looking at life expectancy and mortality, and we need to reinvigorate a better focus on what Andrew's just gone through really, and actually what makes us live well. So I'm going to go through some of the work that we're doing regionally to take that approach forward. So I'm going to cover the Living Well framework, which as you saw was around prioritising wellbeing to reduce inequalities, to talk about the wellbeing survey that we published earlier this year on wellbeing across the Northwest, and then to look at the new public health system, the work that we're doing to take that forward, and indeed Heather and colleagues will be doing here as well. So firstly, we had the Marmot review. I'm not going to steal Mike's thunder because he's going to talk in detail about that, but that really set the scene for us regionally in helping us to take a new direction, a new focus. And a quote that I've pulled out there, which I think is very pertinent to Living Well, that we really need to start addressing the social conditions, and it isn't a footnote to the real conditions of health. It's not that the real concerns are about healthcare and unhealthy behaviours. We need to be looking as a top priority at what are the determinants of health, what are the social determinants and conditions that affect us to live well. What we've seen is a lot of investment in addressing health inequalities over the last decade, and a lot of effort by a lot of people and organisations. But despite that investment, we're seeing health inequalities widening. And this is a kind of a real push for us to, well, is what we've been doing working? If we do more of the same, will we get what we've always got? We actually need to take a different approach now. Use the vast amount of evidence that we've had over the last year or two just to look at, well, there's something in there that we've been doing wrong. There's a new focus that we need to take. We've been focusing on illness. We need to shift that to focusing on wellness. Emphasise there the I of illness. Being ill is something you can do on your own. It's an individual aspect. Being well, you do with other people. You can't be well unless you're with other people. So it's shifting not only from illness to wellness, but also from an individual approach to also a collective approach, that we collectively need to work together to improve our health and to be together, to be in good health. So the Living Well framework, it's not a strategy or a set of targets, it's a call to action. And that call is around, we need to be working together to create the conditions that support us to live well, support our well-being, decent homes, decent standard of living, good work. We need to involve people and empower people in communities as well. Empowering communities on its own will produce good health, but we also need to be involving people in what health looks like, what people want to see from services, in commissioning services, in reviewing and evaluating services, and also in providing services as well. Now, we've obviously been working on that for some time, but we really do need to get better at that. We need to focus on the assets of people to bring about change. And again, Trevor's going to talk later more about the asset approach, but focusing on our strengths, our resources that we have as organisations, as individuals and as communities, and not just focusing on disease, problems and deficits within communities. We need to balance health, economy and the environment, and this is a big change really, a big ask perhaps, when we've got different goals across our organisations. Economic growth alone will not lead to improved health and well-being unless we look carefully at achieving all three of those. So can we get economic growth as well as not bringing any harm to people's well-being or to the environment? So this is probably a big ask. It does need a big cultural change. It needs leadership. You're in the room, you're here, that's great. And it needs a radical shift in focus. So some early actions that are in the Living Well framework, we're asking people to sign up to the Living Well approach. You've got your document here, which is a clear sign up to the Living Well approach. To model that approach in our everyday decision making, how can we take that back to what we're doing day to day with the people that we're working with and how we invest our money? Promoting understanding of Living Well with our staff and our partners, using the powers that we have to the full, whether it's powers to commission, whether it's powers of wellbeing, using those as much as we can for the agenda. Assessing our community's assets, building on our community's assets and our organisational assets, and adopting area-based approaches to deliver improvements. Seen a lot around the neighbourhood approaches. And we also have taken the New Economics Foundation's 5 Ways to Wellbeing as something that we need to communicate more broadly to the public and engage people in taking action. We've got 5 a day, fruit and veg. We have 5 times 30 minutes exercise a day. But what do we do for our wellbeing? What do we do to live well? And they've come up with the evidence around the 5 things. I will tell you those in detail in a minute. So those are our early actions. So we see that the new public health is very much got to be focusing on balancing those 3 aspects I've already mentioned of economy, wellness and environment. And I say public health embracing a wide range of partners within a locality and looking carefully at what are the actions that will enable us to achieve that balance and what are the barriers that we might need to reduce that we're not getting the harmony of that. We need to look carefully at the outcomes. Dare I say it, targets as well, but we're moving into more of an outcome focus, which is great. So what are those outcomes going to be? We need to shift those as well. So we've put 10 down there in the Living Well framework as potential outcomes of focus. We've included deficit indicators as well as asset indicators in order to emphasise those positives. And again, Andrew talked a lot about some of those assets that are in your local area. So we have life expectancy and healthy life expectancy as well, moving towards being healthy within our life, not just our length of life, but our quality of life. Smoking is obviously still an issue, still a priority, and child obesity. But also looking at the assets. What's our resilience like? Our resilience we could measure by people who are redundant in the last year. How resilient have they been to find another job, to enter volunteering or education? How many people are being resilient to coping on their current income or confident in the ability to receive financial help in a crisis? How many people are doing recommended physical activity levels? How many people are participating in local groups? How many people are meeting others outside of their own household? How many report positive mental well-being? And how many people are functioning positively within their local area, being able to influence local decisions, have a good sense of belonging, feeling safe at home? So all of those are aspects that we feel are important to living well, and we have done some research into those in the North West.